Hello, welcome back. In this video lecture, we're going to be talking about another external cause, poisoning. So we'll talk about poisonings, adverse effects, underdosing, which is something we never had to worry about in ICD-9, toxic effects, and complications of medical and surgical procedures. Okay, and again, this is chapter 22B, poisoning, and certain other consequences of external causes. All these codes are T36 through T88. And by the end of this, you'll understand the key terms. You will understand how to code these poisonings, adverse effects, complications, and how we sequence them. Very important. So when we get to that point, please pay special attention. So again, we talked about how these codes in T36 through T50 are combination codes. So what do? They tell us whether this is a poisoning or not, whether it's an adverse effect or underdosing, and they include intent. So with the intent included, we don't need to have an external cause code. So what do we mean by underdosing? Underdosing means that the patient takes less of a medication than prescribed or instructed. This could either be intentional or unintentional and makes whatever condition that the medication was prescribed for potentially worsen. And you'll notice that there's an includes note that states that you must code first the nature of the adverse effect with like gastritis, dermatitis, nephropathy before coding the drug that caused it, right? So these codes, you have to look at the effect for an adverse effect. So again, you'll see some of these here, code first for adverse effect, the nature of adverse effect, including adverse effect not otherwise specified, gastritis, blood disorder, dermatitis, and so on. And you'll note that the drug that caused the adverse effect is coded from T36 through T50, and we use a fifth or sixth character of 5. The number 5 always tells us that this is actually an adverse effect. And we may need additional codes to specify any manifestations of poisoning, underdosing, medication noncompliance, depending on the documentation. And you'll note the last one, that's underdosing of a medication regimen such as Z91.12 and Z91.13 subcategories. Guideline 1C.19.E reinforces that T36 through T65 codes already include the external cause, so we don't need an additional external cause for these poisoning, toxic events, or adverse effects, or underdosing. And again, we'll get into the table of drugs and chemicals. We never code directly from the table of drugs and chemicals. itself. It's kind of like using the neoplasm table that we learned about a few weeks ago, right? And we use as many codes to describe all the substances involved, but we don't code the same medication twice if it applies to more than one condition. And an adverse effect occurs when a drug is correctly prescribed or administered and the patient has an unwanted reaction. This is an adverse effect, right? And again, we talked about adverse effects have a fifth or sixth character of 5. Poisoning means that the medication was used incorrectly. This could be an overdose, this could be a wrong code, wrong route, wrong patient. And we code the drug first, we assign the intent, and then we code the manifestation. And we have specific guidelines for underdosing. Underdosing is taking less of a medication than prescribed, right? They're codes for noncompliance or complications of care that may be used with an underdosing code to explain why it occurred, if that documentation gives us that information. And again, noncompliance or complication of care codes, I would strongly advise that you go and look at these in the tabular. And what some coders do is actually put post-it notes or flags on these codes that describe them. Toxic effects occur when a harmful substance is ingested and comes in contact with a person. And again, these codes fall in categories T51 through T65, and they always include intent. And this could be self-harm, assault, accident, or unintended. For confirmed or suspected abuse or neglect, codes from T74 or T76 are sequenced first. So the Reader's Digest version is T74, T76 for abuse of an adult, abuse of a child, neglect, or other maltreatment. Those always come first. And then we would use any additional codes from mental health or injury codes. And again, how do we find these? Again, very important to realize that a good place to start with these codes is the main term adverse effect. And this directs you to the table of drugs and chemicals. And you're going to be focused on categories T36 through T50 with the sixth character of 5. A main term of poisoning does the same thing, but we would follow the appropriate rules for sequencing that we just talked about. And then the main term for underdosing is, of course, underdosing. And again, this is in a lot of ways, you can think of this as being similar to the neoplasm table. The table of drugs and chemicals has 7 columns. And the first column has the name of the drug, chemical, or biologic substance. And then the next 6 will describe whether it's in poisoning accidental, poisoning intentional, poisoning assault, poisoning undetermined, adverse effect, or underdosing. And again, all these codes are combination codes that have the intent, which is why no additional external codes are needed. Adverse effects are an unintended reaction that occur even when the drug is done correctly. We have the right person, the right medication, everything is done. It's a known effect typically. How do we get adverse effects? We can get them because of cumulative effects, where the excretion of a drug is slower than the rate that the drug is being administered. Allergic reactions, synergistic reactions, like if somebody's taking antidepressants with alcohol or something like that. And then there are just known side effects as well. So how do we code for these adverse effects? First, we code the reaction, then we identify the drug in the table and apply the correct seventh character and code each involved substance. And there may be more than one, so you have to carefully check the documentation. If a patient has a late effect from an adverse reaction, we would code the residual condition first, then the drug code with the seventh character for S. And again, important to remember, we code each drug that's involved. Table 22B shows examples of adverse reaction coding. Please pay special attention to this table. It will help you understand adverse reaction coding. Now we're going to take a look at poisoning. Poisoning is a deliberate or accidental ingestion of a medication or substance that happens when something's done wrong. Could be the wrong drug, could be the wrong dose, wrong route, wrong patient, or a drug that never should have been taken. Poisonings may involve prescription drugs, over-the-counter medications, illegal drugs, or some sort of drug-alcohol combination. For poisonings, we want to code the drug from the poisoning column based on the intent, then code all documented manifestations. One second, there we go. If there's no diagnosis of drug abuse or dependence on the drug, the abuse or dependence is coded as an additional diagnosis. So if they're abusing whatever was written, right, the abuse or dependence can also be coded as an additional diagnosis. If a patient has a current condition that's a late effect, or in other words, a sequela of the adverse effect of a poisoning or overdose, code the residual condition or the late effect first, and then assign the code for the drug with a seventh character S for sequela. And again, table 22B.2 illustrates the poisoning coding. Please pay special attention to this table. I think it will help you understand the coding of poisoning. Now let's take a look at the underdosing. Underdosing was something we never had to deal with ICD-9. Underdosing codes can never be first listed. Very important point. The worsening condition is coded first, followed by the underdosing code and any non-compliance code, if applicable. Toxic effects involve harmful substances that aren't used as medications. Codes are selected based on the substance and intent, with additional codes for all related manifestations. Now we have other and unspecified effects of external causes. We can have injuries or conditions that are caused by these external agents, right? And this covers things like asphyxiation, right? They typically require or I should say, always require a seventh character for the encounter type, and it may be a combination of codes. Adult and child abuse, neglect, or other maltreatment that's confirmed and suspected will always be coded first. There are also codes for the perpetrator from code category Y07 that's added if the perpetrator of abuse or neglect is known. Now we're going to talk about complications of medical and surgical care. These codes describe complications of course, medical and surgical care. There must be clear provider documentation when linking the condition to the care that was provided. It's totally based on the provider's documentation. Some of these complication codes already include the external cause, like a catheter-related infection. So we don't need any other external cause code because it's already included in the code. These complication codes require a seventh character to show whether the encounter is initial, subsequent, or for sequela. And again, we use additional codes for adverse effects, if applicable, to identify the drug with a fifth or sixth character of 5. And we use additional codes to also identify the specified condition resulting from the complication. And finally, if there's a device involved, there are code categories Y62 to Y82 to identify them. The cough scientists refine the formula 44 times to attack your cough at the source, providing powerful cough relief for up to 8 hours. And again, more on complications. Code category T81 includes complications like post-procedural shock, wound disruption, infection, or foreign bodies that are accidentally left during a procedure. If a complication involves an infection or adverse drug effect, additional codes are required to fully describe the condition and any resulting sepsis. And again, we can have complications of prosthetic devices, right? Breakdowns, leakage, other mechanical problems. These would fall in T82 through T82.5, right? And again, these could be anything involving breakdown, what have you. Whoops, didn't mean to do that. We also have other codes that cover complications of genitourinary, orthopedic, or other internal devices. And as you would expect, all of these require a seventh character to identify whether it's initial encounter, follow-up, or sequela. Something we don't see too much is complications of transplanted organs and tissues falling into T86. Transplant complications are used with additional codes to specify the exact complication. And this is the same whether it's graft versus host disease or some sort of transplant-related malignancy. T87 is a complication that's specific to a reattachment and an amputation. T87 captures these types of complications such as neuromas, infections, necrosis, or other stomach complications. We also have things that fall into T88. T88 is relating to complications of surgical and medical care not elsewhere classified. Again, not elsewhere classified means they are documented, but they're not called out specifically. And there's not a code. I mean, they can't be coded specifically because there's not a code that exists. And again, these fall into T86.6 XX, and we always have the seventh character for the episode of care. Whew, I'm tired just talking about it, but let's see if we can break it down into the most important things that you need to know for this chapter. The key is determining whether the situation is an adverse effect, poisoning, underdosing, or complication, and then applying the correct guidelines and the seventh character. Your book has some great examples. Pay special attention to those tables in 22B that will describe how you can code these poisoning, underdosing, and complications. That's all I have for you. Please reach out during office hours if you have any questions about this material. Bye now.